Community Forum on KCCC 930 AM, sponsored by Eddy County, honoring God, country, and family, thriving with industry since 1889.
I'm Hattie Quinn, and I'm here for Community Forum, and my guest today is from BeWell.
Hi, I'm Alex Sanchez. I'm the Chief Experience Officer here at BeWell, New Mexico's health insurance marketplace.
And I hear we're on quite a time crunch for people to sign up.
We are. I feel a little bit like Cinderella. Tonight is the last night. You have to do it by 11:59 p.m. So for those of you who are wondering, what in the heck is this woman talking about? It is the last day of open enrollment. This is the time where if you don't have Medicaid, Medicare, or health insurance through your job, you can come to BeWell and find an affordable and reliable plan that works for your medical needs and your budget.
That's really important. Now, is this similar to the ACA marketplace that's run by the government?
Exactly.
Yeah.
You're exactly right. So people often call it Obamacare. So there's different marketplaces. There's the federal marketplace a lot of people know about, healthcare.gov, and then states can elect to have state-based marketplaces. That's what New Mexico has. So BeWell serves as kind of, if you think about it, a supermarket for health insurance. You come, you can look at plans from Molina, United, Presbyterian, Blue Cross Blue Shield. But the most important thing is BeWell is the only place where you can qualify for subsidies to reduce your monthly cost. So more than 50% of our customers are paying $50 or less a month for health insurance.
That's pretty amazing.
Right? I mean, you can't go through a drive-through for $50, I feel like.
It seems that way sometimes with the family, for sure.
Yeah.
Okay. If I were to sign up today, when does the coverage actually begin?
Great question. So as long as you sign up today, you're going to need to pay for your coverage if you have a premium. Keep in mind, more than 30% of people pay $0 a month. So depending on your zip code, your household size, and your taxable household income will help determine what savings you qualify for. And the system is going to kind of do all those background calculations, so you don't have to worry about that. It's going to tell you what you owe. You have to pay that amount, and your coverage will start February 1st.
Okay, great. So if they signed up last year, their coverage should go through that period, correct? That February 1st, so there's no gap?
Right. So if you have signed up previously with BeWell, you may have been auto re-enrolled in.
Oh.
So if you're busy during the holidays, we all get it. You still have a few days, or you have, a couple hours actually, to go in and look at what you've been re-enrolled into. Make sure it works for you, right? Things change year to year. And we do know that there's been a lot of changes with the federal subsidies. The state has stepped in to cover those costs. And so it's really important that you look at your account. So if you have BeWell coverage now, just make sure you're in the right plan for 2026. If you want to make a change, you still have a few hours to do that.
Fabulous. And we've seen reports that the average premium rates are increasing by about 35% this year.
Right.
How is BeWell able to actually offset those costs?
Right. So the state elected officials, the governor, our legislature, they did amazing bipartisan work to ensure that New Mexicans still have access to affordable coverage. So even though plan rates are increasing, that average of 36%, the state is actually covering the loss of federal money. So you may have heard of a lot of discussion, the federal government shutdown in kind of the fall, early winter.
Yes.
That was all around federal premium tax credits, which are called EPTC. And those have expired now. But we are so lucky to live in New Mexico, where the state stepped up and supplanted that money with state funds. So if you were getting federal money to offset your cost, you're now getting state money instead. So it isn't necessarily a one-for-one, because you're exactly right. The plans themselves cost more, but you can still find affordable plans and you can shop. You may be in a plan now that went up $10 a month, let's say, but you can go find another plan that's going to be a little bit more cost effective if that's what you need. The great thing about BeWell is there's a plan for everybody. If you are in a certain income level, you may qualify for a turquoise plan, which have lower out-of-pocket costs. If you're somebody who doesn't need specialists, doesn't need prescriptions regularly, maybe you're okay with a plan that has a higher deductible, right? And so you're paying less. If you are someone who needs that specialty care, if you're getting regular prescriptions, you're being seen regularly, there's going to be a plan that maybe you pay a little bit more out of pocket each month, but then you have a lower deductible. And I know I'm saying a lot of health insurance terms, right? And everyone kind of goes, oh man, and nobody's got time for this, right? I'm busy. Let us do the work for you. Our help is completely free, and we have a virtual event going until 7 p.m. tonight. You can literally join from anywhere. You're at your kid's basketball practice, you're out hunting, you're at your grandma's house. I don't care. Join us. Go to BeWellNM.com, click that button, join the event. Let us help you for free. We can get you in and out of the event in about an hour and make sure you have health insurance for 2026.
Oh, that's really amazing. And are those your certified assisters? Is that what they're called?
Exactly. Yeah, you're spot on. So we have more than 900 certified assisters ready to help. So, if you're ready to do this, today is the last day. If you're one of those people that needs the last minute, here we are, my friends. The energy is up. The anxiety is high. So you can call also 833-862-3935. You can chat us at BeWellNM.com. You can join that event, or you can actually make an appointment with a certified assistant. Super simple to do at BeWellNM.com. You can see if they have an appointment today. Some of them are taking virtual office hours as well, trying to get as many people in the door as possible. And, this is something I think sometimes people think, oh, well, it's not going to be like real insurance, right? This is something that is real insurance. Every plan has to cover 10 essential health benefits. And this includes your mental health, your physical health, your annual checkups. If you had to go to the emergency room, substance use disorder, maybe you need rehabilitative and physical therapy, right? These are plans that can keep you healthy. And we know that a healthy economy, a healthy New Mexico, starts with this foundational element of health care. And so we want to make sure you're using that plan, right? We want you to be seen. We don't want it to be just in case something bad happens. No, let's make sure you're getting those annual exams. Let's make sure you're healthy. And the last thing we want is for somebody to put this off or assume that it's going to be too expensive for them, get in a situation with crippling medical debt. I mean, that can change your entire life. So let us help you for free. Come at least ask your questions. There's no harm. No one's going to pressure you to enroll, right? We're happy just to talk to you about your questions.
Absolutely. And it's so important, especially for the family on budget, but just anybody, because you don't know what's, going to happen this year. And I heard today on the news that a cancer patient will go through all of their savings within like 1 or 2 years of treatment.
All right. So, and to think that you could be in a situation where someone is saying you have stage 4, stage 5 cancer, you're going to need really intensive therapy, and to learn you could have been getting health insurance for $10 a month. It's just not worth it. Like, give us an hour of your time. Absolutely. And we'll find a plan. The other thing that's great about BeWell is it's a no wrong door. If you come to us and you actually qualify for Medicaid, your application goes seamlessly over to Medicaid. You don't have to fill it out again. We'll help you. If you actually need Medicare services, if you need some other kind of services, we're really there to help you, right? We want to help your whole family too. If you've got, your grandma who lives with you, or maybe an aunt, or your adult child is living with you, we can help everybody. And again, it's completely free. This is something that means so much to us who work in this industry. More than 82,000 New Mexicans, a record number of New Mexicans, are currently enrolled through BeWell. It's so exciting to see healthy communities, and we want you to be part of that.
I love it. Now, what happens if someone misses today's deadline? Are there qualifying life events that would allow them to get insurance later in the year?
Absolutely. So think of things like I had a baby, maybe I lost my job or changed jobs, maybe I got married, or maybe I got divorced. There's lots of things. I like to say that life is very lifey, right, throughout the year. So if things happen, things change, no problem. Come to us. Even if you don't qualify for that moment, we want to be a resource for you. What are your options, right? And I think the other thing that's really important is, a lot of us heard about the big, beautiful bill and that being passed. That actually has provisions that are going to go over the next several years. So a lot of people don't realize there's going to be changes. There'll be changes to Medicaid. There'll be changes to who qualifies as far as their citizenship status. So throughout the year, it's totally appropriate to come to BeWell, ask your questions, get a free appointment. Anyone is there to help you. And that's why we love having that appointment tool. So you can make a connection with someone in your community, right? Someone that you can go to throughout the years and ask questions or change your coverage, right? But people need to know that healthcare is changing, and it's going to continue to change with the federal law.
Right. Oh, that's so stressful.
It can be. Let us do the work for you. Don't feel stressed out. We can help.
Exactly. Did I hear that you had a new enrollment platform? this year?
We do. So BeWell, we like to say we're a better BeWell. So we spent about a year and a half really looking at how do we make this easy? How do we make it? I mean, health insurance is complicated. It can be confusing, and oftentimes it's done, at night when you've worked all day and you've got 2 kids and you're yelling at them to stop hitting each other, right? And you're just trying to get this done. And so we really looked at a platform that would make it easier on New Mexicans. It makes it easier to understand what the terms are. It makes it easier to go through and seamlessly apply. I can tell you my group in particular at BeWell, we're in charge of that consumer experience. And we did so much testing with real New Mexicans to say, does this work for you? Is the Spanish correct, right? We didn't just take some off-the-shelf Spanish that the company offered. We made sure it was the right dialect for New Mexicans. We tested it. And so you absolutely can get on BeWellNM.com. You can see right there where you can browse for plans. And this is also great if you're not quite ready. Go in and shop anonymously, as we call it. Put in your information as far as your income, your household size, your zip code, and it's going to give you an idea of what you could qualify for.
Oh,
so you're going to know
right away.
Right, exactly. You're going to know right off the bat, okay, maybe I'm going to get $500 in federal savings, $300 in state savings. And so if I shop for a plan that's $900 a month, well, it's only going to be $100 for me because I have $800 in savings, right? So you can really play around in the system before you have to make a commitment. I get it. It took my husband 7 years to propose. Commitment is hard. I understand. So you can get around, you can play in there. And really what's important is you just have to take some type of action by 11:59 p.m. tonight. So as long as you do that, you can leave us a voicemail, you can chat us, you can start an account and call us the next day. We can help you still then get enrolled. We just have to show that you started the process. So if you are working, you have a late shift tonight, you're not getting off till 11 p.m., go on BeWellNM.com, create that account, call us tomorrow, and we're happy to help you.
Oh, that's fantastic. I can't believe how user-friendly this actually is.
Right, that's the surprising thing. And I will tell you, not only is it surprising how much better the system is and how easy it is, but people have come to our office and they think we're lying. They're like, no, there's no way I'm getting health insurance for $20. And it's like, you are. So please don't just assume that you're not going to qualify. If you're making 400, 500, 600% of the federal poverty level, you may still qualify. And I know no one knows what their federal poverty level percentage is, right? But if you're making 6 figures and you're in a household of 4, 5, 6 people, you may qualify for savings. So don't just assume that it's not for you. Let's at least put you in, see what we can get you.
Oh, I love it. All right. And you gave us the website a couple of times, BeWellNM.com. Let's get that number again.
Sure. 833-862-3935. That number will have live agents available until 7 o'clock tonight. Again, we also have our virtual enrollment event. That goes until 7 p.m. tonight. You can get online. You can chat us. You can start that account on your own. You can enroll on your own if you want. But man, we are so excited to see record-breaking numbers for the 3rd year in a row, more New Mexicans than ever utilizing this. And it's really a testament that people need health insurance. This is not the time to go without health insurance.
Absolutely.
Please. Yeah, just give us a little bit of your time. We are happy to help you absolutely for free. We want to see you insured in 2026.
Excellent. I feel like we've covered why they should do it, how they should do it. I assume that after 7, when the event ends, they do the enrollment online still, at least to get set up, to get started, so that they can get in with a certified assistant the next day. What else do I need to know?
I would just say this, just a reminder that BeWell is here for you year-round. If you do miss it, if your life changes a month from now, it's okay. We can help you. We'll figure out, where you can go, how you can get the coverage you need. But this is the time. So please just don't let this opportunity pass by. It's just so important. And, if you are somebody who's getting these savings from the state, the legislative session starts next week. We are encouraging people to contact their legislator and thank them for their commitment. We want this funding to obviously continue, and it's something that they'll be talking about this session. So, if affordable health care means a lot to you, please thank your legislator, thank the governor for the work they've done on this, and ask them to continue that hard work.
Oh, thank you for bringing that up, because that's an important step too. We all need to communicate about not only what makes us mad, but also what we really like.
That's right. Yep.
Well, thank you so much. I appreciate you doing this call last minute so we could get it in before the deadline.
We so appreciate it. Thank you. Very grateful.
And I'd love to talk to you again earlier, later in the year, but earlier in the enrollment period. Sorry.
Sounds good. Have a great year if I don't talk to you.
Awesome. You too. Thanks for your time.
Thanks. Bye-bye.
Thank you as always for listening to Community Forum at KCCC 930 AM.
You're listening to Community Forum on KCCC 930 AM, sponsored by Eddy County, honoring God, country, and family, thriving with industry since 1889.